Hello! Hi guys, this is UX designer Lisa Lee. I know that I've been taking a long break from posting and uploading any contents in the channel for a while, and that is because I was going through a surgery to remove my pituitary gland tumor. It's been 2 months since the surgery date. For those of you who don't know where pituitary gland is, it is located in between your brain and your nose. It's right in between, in the middle. And it is a control tower for all of your hormones. So for today's video, my partner and I have prepared a Q&A session regarding the pituitary gland tumor that I had and the surgery that I went through, so that I can help those who are stuck with the same kind of symptoms that I had previously, or who are going through this pituitary gland tumor as I have in the past.
Alright, so question 1. When and how did you find out about the tumor?
It was last year, November, in Korea that I found out about the tumor. It was very odd. So I had a symptom, which was not having a period. I wasn't having my period for about 6 months. And that's weird, right? It's not like I'm pregnant. I wanted to get my whole body checkup because I was like, okay, what if something is wrong with my body? Maybe something is there, so that's why I'm not having my period. So we went to Korea and did the whole body checkup, and the result came out and it said my health seemed good. Nothing really stood out. So my mom actually suggested for me to visit a gynecologist. So I went. She recommended to do a blood test, so I did. And when the result came out, she told me that there is one hormone called prolactin that is way higher than the normal range, which is odd. And she thinks that might be the reason why I'm not having my period. But this could actually indicate another illness. So she wanted to make sure it's not that or it is that. So she recommended me to go take an MRI. And once that result came out, I went to my gynecologist and she told me that I have a pituitary gland tumor. And that's when I found out.
How big was the tumor?
Mine was 0.3 centimeters, and that is determined as microscopic. So 1 centimeter is the line. So any tumor that is bigger than 1 centimeter is determined as macro, and anything that is smaller than 1 centimeter is called micro.
What were some of the symptoms?
One main thing I would say is not having a period. I always had irregular periods. I never really had regular periods, but I never actually didn't have period for a few months. I think last time I had that before this, prior to this, was when I was actually going through a stressful situation, and it was causing me to not have period for about 3 months. And when I went to the gynecologist, they suggested birth control pills. But this time it was a bit different. I was not having a period for about 6 months, and I thought maybe I wasn't eating enough. So I started eating more than usual to fill up my body, saying it's okay, but it wasn't coming back. Other minor symptoms that I had I started having these weird kind of headaches. Of course, I know what headache feels like, but this one was weird. This one was different. It was right in the middle of my head, like literally right in the middle. It was the kind of headache where it felt like someone was poking the middle of my head with a needle, like constantly. It was just very weird. I never had that kind of headache before, so I wasn't sure what was going on, but those two are the main symptoms that I had.
Why did you decide to go through surgery?
When I first heard about pituitary gland tumor, I was given two options. One was to take a medication and not do the surgery. Two was don't take the medication and just get rid of it with a surgery. And those two options were given to me because my pituitary gland tumor was microscopic. If it was macro, then they would suggest me to go for a surgery immediately. So because I was scared and it's like, in your head, I didn't really want to go through a surgery. I was kind of scared to go through a surgery, so I chose to take the medication. I got the medication from Korea, part of it, for a few months, and then I got the rest of the month's worth of medication from a hospital here, UCSF. And so I started taking medication, but it was giving me a lot of side effects. It was giving me a lot of bad reactions, basically. Ever since I took the medication, I started having a lot more frequent, a lot more, painful headaches. And it was just to the point where I couldn't work or I couldn't do things, my normal activities. It was just affecting, that because it was so painful, the headache was so painful, it was affecting my mood as well. It wasn't doing any good to me. And, the reason why the medication has those kind of reactions to you is because that medication is very strong. What it does is it breaks down your tumor and stops it from growing further. And so because the symptoms were so painful and it was affecting my everyday, I just decided to go for a surgery and get rid of it and just go back to normal life without any headaches or symptoms.
Can you describe the surgery procedure?
Well, first of all, I was very nervous. I honestly didn't feel much until I entered the hospital and they started, prepping me for the surgery. Then I started getting really nervous and scared. But basically, what kind of surgery it is, because it's microscopic, you can remove this tumor through your nose. And there's a wall between your nose and your, brain. And so they would go through my nostrils, go through my nose to break the wall to get to the pituitary gland and, grab all the tumors, remove everything, take it all out and close it back. That's the surgery. That's basically the surgery that I had. The day of, I went and the prepping room, it was just so busy. All the surgeons, all the, nurses, they all seemed so busy. And I was given all these, prepping materials, right? Like, clothes to change to, socks to wear. And I was, guided to my bed, my area. And literally rounds of doctors came to check on me. And, of course they had to poke me a lot for IV and blood test and all that. There were two surgeons who operated on me. One was an ENT surgeon. The second one was the neurosurgeon. So the ENT doctor, they are specialists in eyes, nose, and throat. So because my surgery was through my nose, the ENT doctor would come in and break the walls behind my nose. And then once that is complete, the neurosurgeon would come and remove the tumor from the pituitary gland. And so 2 surgeons were operating on me. So a lot of the residents, a lot of the, surgeons, doctors, they all came to check on me. Once I was all prepped, once I was ready to go, I had to say bye to my partner, and I was, I was just lying down in bed, and they led me to the operating room. It wasn't the anesthesia, it didn't come through a mask. It was through my IV, and I felt it. It was very cold. It was like very weird feeling. It was like kind of painful, and I fell asleep. And when I woke up, I was in my recovery room, and I saw my partner and my brother there, along with the nurse. And that day, I was basically unconscious. I was just way too sedated, so I was sleeping all day, and I had to eat to heal. So I woke up for a couple of bites of chicken porridge from the hospital, and I just fell asleep the entire day. But I didn't feel any pain. Oh, and also I had this thingy under my nose because, blood and gooey stuff were coming out from my nose post-operation.
How was the recovery? How long was the recovery period?
Well, I'm still recovering. It's been 2 months since the surgery, and the doctor told me that for a full recovery after surgery, it takes about 3 months. But currently, I'm not having any symptoms, and I had a follow-up call with my doctors, my surgeons, and they all told me that I can go back to my normal daily activities. So I am doing all that right now. Post-surgery, right after, I think the hardest is the first 2 weeks. A day right after the surgery, I couldn't breathe. I couldn't breathe through my nose because it was all clogged up, and they had to put these like little clogs up on my nose so that it could hold up the wall that they broke down. And I also had this band underneath my nostrils, so I couldn't breathe for about 2-3 days after surgery. I had to breathe through my mouth. I was basically a mouth breather. And that was very difficult for me. Because I couldn't breathe through my nose, I couldn't sleep well at night. So I was pretty much sleep deprived. But after 3 days, I was able to slowly breathe through my nose again. Not fully, but it was slowly coming back. I was slowly able to breathe through my nose. So that's when things started getting better. Post-surgery, I have to take pain medications because the headache, it's pretty painful without the pain medications. And one thing that I misread from the guide is taking pain medications on a regular schedule. So you have to take it like every 10 hours or every 8 hours, and then gradually, make the duration time longer so that you can be off of the pain medication in about 2 weeks or so. But even besides the headache, there were a few things I had to be careful of. And I can actually state those and share those with you because I have the guide with me. So for the nose itself, for about 6 weeks, you are not allowed to blow your nose or rub it vigorously. You are not allowed to sneeze with your mouth closed. So because it's like there's like so much stuff in my nose, I had to sneeze a couple of times, and I always had to remember I have to open my mouth when I sneeze. So that's another thing. And you are not allowed to use straws as well. So anything that puts pressure in your head, you're not supposed to do. Anything that causes, any tension in your nose, you're not supposed to do. I also had to rinse my nostrils every day, twice a day. Some of the activities that I had to keep in mind were I was not allowed to lift any heavy objects over 10 pounds. I had to avoid bending because when you bend, it puts pressure in your head. It says do not travel by airplane for 3 days after surgery. It also says gradually increase your activity. It also states right here, when you feel tired or have headaches, stop and rest. This kind of things to keep in mind, you must keep it for at least a month. After that, after 6 weeks, you are slowly able to go back to normal schedule, but this really depends on the person, and this really depends on the size of your tumor and what your doctor, your surgeon tells you. Because I had follow-up calls with my ENT surgeon and my neurosurgeon, and both of them told me I had to confirm that things are looking good, I'm healing well, in order for me to go back to my normal daily schedule.
Any tips for anyone going through the same situation or issue?
I would say the first tip for anyone is to get your body checked. Whether you're having symptoms or not, whether you're young or not, it doesn't really matter. Like, you should always have your body checked up. If there's any symptoms, go to a specialist to find out what it really is. Because for me, when I didn't have my period and I started having these weird, headaches, I wanted to know what it was so bad. Like, whether it's illness or not, like I just wanted to know what it was so that I could be relieved. And when I found out that it was a pituitary gland tumor, although I was scared because, they said it's a tumor that I have, I was also at the same time pretty relieved. I was relieved to find out what it was, what was causing me to have these symptoms. And number two, for those of you who actually do have these symptoms, like you're not having your period, or you actually do have a pituitary gland tumor, it's okay, don't be scared. If you are not having a period, go get it checked by a gynecologist. And if they, refer you, like if they recommend taking birth control pills, like tell them, hey, can you do a blood test on me? Because I want to know if everything is in, every hormone, everything from the blood test, it's in the normal range. I want to make sure, because something seems off. Just because you don't have your period doesn't always mean you're going to have pituitary gland tumor. So make sure you go to a gynecologist you trust and who will care for you, who will tell you what it is that is causing your symptom. And also another tip, when you're going through pituitary gland tumor, you might go through a roller coaster of emotions. At least for me it was, and I know that my partner actually went through a lot during that time, and I really appreciate and thank him for that. You might get really sensitive. I was very sensitive because the headache was so painful, especially after taking medication. It was to the point where I couldn't really focus, work, or do anything. I had to lie down. That's the only thing that I could do. Take Advil and lie down and rest. So I just want to tell people who are going through the same thing, taking medication or not, it's okay. It's okay to be sensitive. It's okay to have these roller coaster of emotions. It's not you. It's just because you're going through so much pain, because your body is going through so much things in your pituitary gland. That's why it's causing you to have those kind of sensitivity. Now I am completely fine. Going through this pituitary gland tumor and the surgery and the post-op recovery, this whole journey actually gave me a time to reflect on my life and my priorities. And I feel like prior to this, I was so focused on success and, proving myself to the world. But after this journey, I realized that, yes, it's great to be passionate in your field and you want the success in your life or your family, whatnot. It's all great. But what really matters is your health and also the people around you. Okay, so That is all the questions that my partner and I have prepared. But for those of you guys who have further questions about pituitary gland tumor or the journey that I had or the medication, anything, please comment down below and I'll try my best to answer all of your questions. Hope that was helpful for you guys, and please like and subscribe.